Welcome to Sketchy. We take all the super complex stuff you need to learn and turn them into memorable visual stories packed full of everything you need to know on test day. Click the link in the corner or description to try for free for 7 days. Now let's get to it.
Acute kidney injury has ever so many causes, which means that the presentation and management will vary and depend on the underlying cause. This makes teaching, learning, evaluating, and managing AKI about as satisfying as training angry blindfolded chickens to do a synchronized tap dance at the county fair. But all AKI cases do manage to converge in one magical place, the capable hands of the nephrologist in their beloved dialysis unit. This is going to be the easiest and most fun of all the AKI videos because we're just going to cover the 5 indications for urgent renal replacement therapy. But first, we should mention that step 1 in management is always to discontinue all the nephrotoxic medications that can safely be stopped. This aspect of management falls into a category that I like to call a DOI. And now for the question that has brought us all here. Does this patient with acute kidney injury need dialysis? The answer lies in the vowels A, E, I, O, U. A is for metabolic acidosis. So our first stop is the lemonade stand, where less than 72 cents will make you feel cool and refreshed. But a serum pH less than 7.2 will make you feel like garbage water in a bucket. So if you're doing all you can to treat the underlying cause and giving sodium bicarbonate, but the pH refuses to creep above 7.1, then dialysis it is. E is for electrolyte imbalance, specifically hyperkalemia above 6.5, or signs and symptoms of a high potassium that are not responding to medical therapy. These signs and symptoms include muscle weakness and EKG changes like peaked T waves, AV or bundle branch blocks, and arrhythmias. The astute student will notice that the bananas at the top of the E bush spell out 6.5. I is for ingestion of nephrotoxins and pie.